Welcome to the EQIP curriculum. In this video, I will introduce an opportunity for growing practices to participate in EQIP. Let's begin by reviewing EQIP's 3 specific volume threshold requirements for participation. These requirements were set by the Health Services Cost Review Commission to ensure that a sufficient proportion of care partners are likely to engage with the selected episodes of care during the performance year. The first requirement is that the EQIP entity must be attributed 11 or more clinical episodes within each selected clinical episode during the baseline period. The second requirement is that the EQIP entity must be attributed 50 or more clinical episodes across all clinical episodes selected during the baseline period. The third requirement is that of the MPIs that make up the EQIP entity, 75% must have at least one claim with a non-excluded beneficiary who triggered a clinical episode in each clinical episode chosen during the baseline period. It is important to note that this claim threshold is only 50% for EQIP entities with 10 or fewer care partners. Some organizations, specifically new or growing practices, may have trouble meeting all of the EQIP volume thresholds required to participate. Some common reasons why an organization may not meet the volume thresholds is because they have practitioners that started practicing after the baseline period. These practitioners would not have volume or claims on EQIP episodes in 2019. Another reason may be the organization has one or few practitioners contributing to low volume. Finally, some organizations may have or had in the past small Medicare patient populations contributing to low volume as well. As a result, MedChi, the Maryland State Medical Society, has created MedChi EQIP entities to group these organizations and practitioners who do not meet the volume requirements to give them an opportunity to participate in EQIP. A MedChi EQIP entity is a collection of one or more practitioners or care partners who enroll and participate in EQIP together with the support of MedChi. MedChi entities are typically split up based on specialty. A full list of the 2025 MedChi entities are listed on the slide. I'm now going to walk you through an example of 3 individual organizations that do not meet the EQIP volume thresholds. Let's start with Organization A. In the baseline period, the care partners in Organization A were attributed 10 low back pain episodes and 8 osteoarthritis episodes. Unfortunately, this means Organization A does not meet the first volume threshold that requires an EQIP entity to be attributed to a minimum of 11 episodes per episode category. As a result, Organization A would be unable to select low back pain or osteoarthritis episodes, making them ineligible for participation. Now let's look at Organization B. In the baseline period, the care partners in Organization B were attributed 16 low back pain episodes and 25 osteoarthritis episodes. This means Organization B was only attributed a total of 41 episodes across all episodes during the baseline period. Even though Organization B has at least 11 episodes in each episode category, it does not meet the second volume threshold that requires an EQIP entity to be attributed a minimum of 50 episodes across all selected episode categories. Last, let's look at Organization C. During the baseline period, the care partners in Organization C were attributed to 65 low back pain episodes and 42 osteoarthritis episodes, bringing the total episode count to 107 episodes. Unlike Organization A and B, Organization C meets the first 2 volume threshold requirements. However, Organization C does not meet the third volume threshold that requires 75% of the MPIs in the EQIP entity to have at least one claim on an episode during the baseline period. Organization C only has 13 of its 19 care partners with a claim, which is only 68%. EQIP entities do have the option to edit their episode selection and care partner list to meet these requirements. However, for the sake of this example, I'm going to assume that these 3 organizations want to participate in EQIP without making any changes to their care partner lists or episode selections. Therefore, a possible solution for Organization A, B, and C would be to join together and form a MedChi EQIP entity. If all 3 organizations enroll together in a single EQIP entity, the care partners in the entity would now be attributed to 91 total low back pain episodes and 75 osteoarthritis episodes in the baseline period. This brings the new total episode count to 166 episodes. In addition, the entity would now have 27 out of 36 practitioners with at least one claim in the baseline period, which is 75%. By joining together, these three organizations that were ineligible on their own now meet all three EQIP volume threshold requirements to participate without having to edit their care partner list or episode selections. If your organization wants to enroll in EQIP, but you do not meet the EQIP volume thresholds, a MedChi entity may be able to help you. MedChi is happy to support any practice no matter the size of their organization or their affiliation. Please reach out to equip@crisphealth.org to learn more and determine if MedChi can help you. Do you want to learn more about EQIP? Visit the full EQIP curriculum to explore comprehensive learning modules and deepen your understanding of Maryland's Episode Quality Improvement Program.